Good afternoon and welcome to Thoughtful Thursday, where we continue to share positive and inspiring developments from across primary care in the United Kingdom. Today's episode focuses on a quietly impactful initiative that is improving both patient understanding and clinical effectiveness: the introduction of clearer, more personalised care plan summaries following consultations. Across many GP practices and primary care networks, there has been a growing recognition that a significant amount of important information can be discussed within a relatively short consultation. To support patients in fully understanding and retaining this information, practices are increasingly providing structured care summaries after appointments. These summaries are designed to capture the key elements of the consultation in a clear, accessible format, including clinical findings, agreed treatment plans, medication changes, safety advice, and any required follow-up actions. This approach ensures that the consultation does not end when the patient leaves the room. Instead, it extends into a clear and supportive care journey, where patients are able to revisit the information provided and take an active role in managing their health. For many patients, particularly those managing multiple conditions or complex treatment pathways, this clarity is invaluable. It reduces the likelihood of confusion, supports adherence to medical advice, and provides reassurance that nothing important has been missed. Patients have responded extremely positively to this development. Many report feeling more confident in understanding their diagnosis and next steps, which in turn reduces anxiety and uncertainty. Having a written or digital summary allows individuals to reflect on the consultation at their own pace, discuss it with family members if needed, and refer back to instructions without relying solely on memory. This is especially beneficial for those who may find consultations overwhelming or who require additional support with health literacy. From a clinical perspective, these summaries reinforce the effectiveness of consultations. Clinicians are able to ensure that key messages are clearly documented and communicated, reducing the risk of misunderstanding or non-adherence. It also supports safer prescribing and follow-up, as patients are more likely to take medications correctly and attend any required reviews or investigations. Practice teams have also experienced wider operational benefits. Reception and administrative staff report a reduction in follow-up queries relating to treatment plans, medication instructions, and next steps, as patients already have access to clear guidance. This not only reduces pressure on frontline staff, but also allows practices to operate more efficiently, with fewer avoidable interruptions. In addition, this initiative strengthens continuity and coordination of care. Clear summaries provide a consistent reference point for both patients and clinicians, supporting more seamless interactions across different appointments and services. They also contribute to improved documentation standards, ensuring that care is both transparent and well recorded. There is also a broader cultural impact within practices adopting this approach. It reflects a shift towards more patient-centered communication, where clarity, accessibility, and understanding are prioritized alongside clinical decision-making. Patients are increasingly seen as partners in their care, and providing them with clear, usable information is a key part of that partnership. This development highlights an important principle within primary care: that how information is communicated is just as important as the information itself. By ensuring patients leave consultations with a clear and lasting understanding of their care, practices are improving outcomes, strengthening trust, and enhancing the overall patient experience. At General Practice Solutions, we are proud to support practices by strengthening the administrative and operational frameworks that make initiatives like this possible. Through improved workflows, structured communication processes, and consistent support, we help create the capacity for practices to deliver safe, effective, and patient-centered care at every stage of the patient journey. Thank you for joining us for this week's Thoughtful Thursday. We look forward to sharing another positive story from primary care with you next week.